Front of valley fever research, conducting a year-long project looking at the correlation between weather patterns and the presence of valley fever in the air. The Now's Emma Lockhart has more on this cutting-edge research and efforts to keep the community safe. Emma?
August is Valley Fever Awareness Month, and experts tell me there are still many questions about when people are most at risk of contracting the disease. But the Public Health Department is looking to change that, gearing up for a year-long research project that will hopefully help protect people from a disease that affects thousands in Kern County every year.
What we're seeing now versus what some of the people were seeing 10, 15, 20 years ago is the difference between hope and hopelessness.
Hope renewed for Rob Purdie and many others living with valley fever. New research efforts aim at trying to help protect people from contracting the disease.
It gives us the strength to get through a drug that makes us sick, or a treatment that makes us sick, or just not having any energy to go to the park with our kids.
Kern County Public Health spearheading a year-long research project looking into the correlation between weather and the presence of valley fever spores in the air.
On any given day, if it's a higher wind condition, if it's after a rainy time, is that going to increase the likelihood of these valley fever spores being present?
The Center for Disease Control donated 4 air filter boxes to Public Health. The devices will be placed outside in different areas of the county and monitored for a year. Experts hope to gain scientific evidence on how weather patterns impact the spread of the disease. In turn, their research findings could help create an alert system for the community.
After we've collected all this data, if we do have the data demonstrates that on certain days you're going to be at higher risk, it being like the bad air quality system.
Valley fever is a disease caused by breathing in spores of fungus kicked up in the air from the soil. The most common symptoms are cold or flu-like. For Purdie, who has a rare and more severe case, the findings of this new research project could provide more peace of mind.
Friends and family of mine that are supporting me are also breathing the same air, and they could inhale at any time a spore, and maybe they get sick like me, maybe they don't. But I always worry about that.
Although experts don't know exactly what they'll find during the project, they remain hopeful.
The thought of being able to make a difference for families in this community is an incredible thing that we're all feeling right now.
Public Health says they plan to place the filters in the community sometime this month. Officials say they don't know how long it will take to release the research data after the project is over, but they hope to get that information out to the public as quickly as possible. Reporting in studio, Emma Lockhart for the Now Bakersfield.